Well, all week long in the first week of the new year, we are going to be talking about fitness because that's what a lot of people do.
That's right. Hopefully sugar not as included. Steve Bunin here to kick off this new series. Steve, what you got?
Yeah, so if we had done this 6 months ago, I'd do basketball, right? But I haven't been able to do that. As you guys know, for the last couple of months, I've been dealing with some major lower back issues. We tried not to share it with you guys, but I don't mind telling it. I had a torn hip labrum, 1, 2 herniated discs, and then most painful of all, a pinched nerve. And it sounds like it's no big deal, but I can tell you it is debilitating. So I had 3 procedures to deal with it all, and now I'm doing physical therapy, and that's where you get in, because it turns out when it comes to lower back issues, you may not have those kind of problems, but it turns out I'm not alone.
Back pain, it's definitely one of the most common things that physical therapists treat.
You're going to lift your hips up towards the ceiling.
Sarah Bendit is my physical therapist. She holds a doctorate from UW and says the most common myth about bad backs is what to do once you're hurt.
Probably the most common myth that I find myself working against is the idea that movement is bad or dangerous if you have back pain. You know, of course, it's important to move in a way that's safe and that's not going to cause additional injury, but continuing to move even if you have back pain is very important.
Bendit says 10 minutes a day can do a ton of good. You just have to stick to it and know what you're doing, because a bad back isn't always just about your back.
Because having good hip strength and hip mobility can help take a lot of stress off of your back.
You should bend down so that you're then using your legs.
Americans spend about $50 billion each year on back pain, and Bendit says if you don't want to join that club, be proactive.
These issues are easier to address if you come in and get a stretching and strengthening program earlier rather than waiting until you've had the issue for a long time.
So one of the interesting things that I learned in just researching this story is that more than 1/3 of Americans say that lower back pain affects their daily life, and that lower back pain, it's the number 2 reason people go to the doctor in our country behind the flu. That's the biggest reason.
Wow,
Your kid
didn't
gets
realize
sick,
that.
but otherwise lower back issues. And so I've learned a lot of stuff about your core, which I'd read about. You know, I'm a pretty fit guy, I feel like, but I didn't realize how little my core had been doing and how much the rest of the quads, the hammies, the lower back is taking on that problem. So a lot of it is fixing your core, strengthening your hips, and hopefully getting yourself back
Because
into
like
gear.
you said, you don't even realize it, but just barely you were favoring one leg over another, and over
Right.
time,
The
that
left leg
exacerbates
has
the
become
problem.
much weaker, and so that's one of the things that we're working on in my physical therapy. And I just was surprised to see so many people in our country and around the world deal with lower back issues. The way we sit, the way we type, the way you drive. If you're a little bit off, and I am, and over time, you'd realize your back is a little bit out of alignment. So there's a lot of ways to do better. This is just how I'm experiencing my road to recovery.
But unless you're in pain, you have no idea how debilitating it is,
Yes,
right?
I can
And
just
how it affects everything.
Tell you, and it just sounds so wimpy. Like if you say, I have a fractured leg, people understand. When you say I have a pinched nerve, they're like, well, just tough it out. I mean, I did, but it was painful.
Yeah,
you guys
I
know,
know.
I'm
I
not
saw
trying
you,
to
man. I
get,
felt bad.
I'm not trying to win any
for you.
sympathy. I'm just saying, I learned that a pinched nerve, it's like pressing on you all the time. You can never relieve yourself of the pain. So I needed those procedures to get better, but now this will prevent it hopefully from happening again. Knock on plexiglass.
Yeah. Okay. Thank you, Steve.